Hello and welcome. You're watching FII. I'm Sonal Mehrotra Kapoor. Now, today is the all-important day, an iconic day, a milestone day, when the jabs and the vaccine for coronavirus actually reached homes. And today, by around 1 p.m. or so, over 1 million people had already registered for the government's CoWIN portal, and that was to get themselves that vaccination. The second phase kicked on. There were some teething issues as well, but more importantly, the vaccine enthusiasm, which was earlier, and vaccine hesitancy, that seems to be now kicking in. The launch also saw top political leaders, from the Prime Minister to the Vice President to the NCP chief, other chief ministers as well, across the spectrum, all come out and set an example, inoculate themselves as well. And this is the need of the hour. Why? If you're still doubting it, that is because India is now repeatedly recording the second highest number of cases after the USA at 1.1 crore. Last 24 hours alone, India has reported over 16,752 new infections. That has led to spikes in certain pockets across the country as well. So how did day one actually fare? Well, to talk about that and answer some of your questions as well, I'm very delighted to have Arish Sharma with us on the program today, India's top bureaucrat. Hello and welcome to FII, sir. Thank you for taking our time for NDTV. Mr. Sharma, actually, before becoming the head of and the chief of the CoWIN app, has held several hats. He used to head and was an important part of the TRAI, has also been a key architect in the Aadhaar as well. So he pretty much knows how it all works, and his perspective is going to be so important. First up, sir, let me start by asking you, what are the numbers telling you at this point? We understand that the vaccination for day one has now ended officially. So at the end of day one, what were the big learnings for you, the big yays and the big nays?
Well, thank you very much for having me on your channel. Just to give you a glimpse of how the IT system, so to say, the CoWIN, as it has worked, is that we have got about 22,87,000 people registered on our system by 6 p.m. today. So that's one part. Initially, there were a lot of confusion in the people in the morning. People were looking for an app. And we had said since the very beginning that we are not launching any new app. We are basically, creating an extension on Arogya Setu app, which actually has been doing the tracking and tracing of the infection. So that is where we have created an extension where you can register and schedule your appointment. Similarly, we have a CoWIN portal with the address cowin.gov.in on which you can register and schedule an appointment. Right. So both these are the two inlets, so to say, available as of now. Maybe in future we will extend that to further inlets. But unfortunately, people were looking for an application, mobile application, which it did not exist, and therefore there was a lot of confusion.
Right.
But
so
nevertheless,
so when you say registration, sir, does that give you an idea about how many people actually got it? Because one login can lead to several registrations.
22,87,000 people have registered. People means mobile numbers have registered. Now, each mobile number can register up to 4 people. So even if you consider an average of 2 people, husband and wife or 2 family members on an average, the number of people who have registered on the system since morning till 6 p.m. today is about, 46 lakhs approximately. So that's the number. With regard to the people who have been, say it again, please.
Is that the target sort of that you were looking at? Are you underwhelmed, overwhelmed with the numbers?
No, we are not looking at any target. This only proves that people are, the so-called hesitancy, I think it's giving away. And people are willingly registering themselves on the system and getting appointed.
Right.
Getting appointments in the
My next question, sir, is how much of these registrations then translate into vaccinations that took place today?
Well, I don't have the number at the end of the day at this point in time with me. But you see, what has happened is that for the first time in this second phase, we have included about 12,500 private hospitals, which are either Ayushman Bharat empaneled hospitals or CGHS empaneled hospitals, or even in those states where you do not have Ayushman Bharat like Odisha, West Bengal, Telangana and Delhi, all the hospitals which are recognized by the state insurance schemes, they are also part of the system.
Sure.
Therefore, we have overall approximately 12,500 private hospitals and approximately the same number of government facilities, which is about 25,000 in number. And so if everybody becomes active, so to say, and if we consider 100 as an average, which is a very conservative average because many hospitals will have the facility to do many more hundreds, even then you will have 25 lakhs vaccination per day.
All right, that's a good number, isn't that? Because, you know, my question, and before I have some questions regarding the registration process as well, but before I come to that, I just want to understand this big picture here. So far in the country, sir, we've ended up vaccinating less than 1% people. That's basically healthcare workers and frontline workers. Now, if that pace were to be considered, it would take years to vaccinate a country the size of ours. So, are you hoping that this pace at the moment that you've seen on day one, is it good enough to meet the kind of demand at this point? And what exactly is the pace then perhaps that you're hoping for vaccination?
Let's understand that the phase 1 and this phase 2 from 1st of March, there's a fundamental difference. You know, in phase 1, we were catering to a select audience of our health workers, of our frontline workers. And the way we were doing it was essentially collect their data, inform them and invite them. And there were a lot of no-shows and people were not able to come forward and stuff like that. So this was basically a supply-driven approach for an audience which was actually a prefixed audience. Here from this part, you know, from 1st of March, we have changed the strategy from a supply-driven to a demand-driven situation, where people are themselves coming and registering and getting schedules, number one. Number two, now for the first time, we have introduced private hospitals into the system, which is a significant number. And that both these, you know, combined together, we expect that there will be a significant jump in the number. Obviously, we are not saying that, you know, the numbers earlier were less or more, because essentially the approach was different and the audience was different. So let us not compare these two kind of scenarios.
Okay. Okay, fair enough. But you don't have any number in mind as to by when do you plan to achieve a particular coverage in the population?
The number will be subjected obviously to the people coming forward and availability of vaccine. That's, I think, there are two, you know, limiting factors. So therefore, I will not like to venture a guess about the numbers.
Okay, sure. So let me come on the registration process then. Well, I'll give you my example. I tried to register for my father this morning. Right? He's above 60 and I went on the app. He's obviously not very tech savvy like a lot of our elderly in the country. And we went on and some people, you know, I'd already known by then that there are some OTP glitches, etc. I didn't face that. But what I did face was not getting any slots on the website. Is that one of the major things you have heard as well? And what are you doing to sort of set the system in place?
See, put it this way, it's a very interesting, again, it's a very important question and a very interesting observation. You see, this is day one. Now, what has happened is that the private hospitals, once they come on board, they have to publish the schedule of vaccination. It's like this, that unless you publish the timetable of the train, people cannot make reservations on that train. I think I give a very clear
That's
analogy.
A good example, yeah. Yeah.
So basically what has happened is that people, you know, the hospitals have to publish the timetable, and they should publish the timetable for, you know, 15 days, 30 days going forward. So I think there might have been some delay in doing that. And of course, availability of vaccine, because vaccines also have got to be supplied and, you know, they have to be picked up by the hospitals. So this is another factor. So depending on, you know, these two factors, which actually some hospitals had done it, some could not do it. That is why you saw this lack of, you know, hospitals which are visible in the system. But
Right.
as soon as the hospitals put the time, and we are going to have a meeting tomorrow, me and health secretary, and we are going to talk to the private hospitals as also the state leadership to tell them that, bring more and more, provide the vaccination. I think they have provided the medicines, plus also educate the hospitals that they should publish the timetable, because maybe they are waiting for people to come in, and they didn't realize that people will come in only when they see them on the list, and they will not be visible on the list unless they
Okay.
publish their timetable.
So you're hoping to resolve it in the coming few days. Another
Absolutely.
observation we saw today was that about the walk-ins. And with this present phase, will the elderly, we're only expecting this to happen more and more, correct? In
Right.
Delhi, for some reason, we did not see a lot of walk-in facilities being provided. In cities like Mumbai and Bengaluru, we saw some sort of registration desks very proactively being put up by some private hospitals, where the hospitals were helping the elderly register. So is there any guideline that you have rolled out that hospitals have to cater to, something that is a miss in Delhi at the moment maybe?
Now, let me put it very clearly for your viewers that one is, as I explained to you, the method of pre-registration and getting a schedule and appointment. It's like in a train, again, a train analogy. In the train, you have certain unreserved compartments and you have certain reserved compartments. The good thing about reserved compartment is that once you make a reservation, then you are sure of your place. You will get a seat or berth, whatever you want. Now, there is always a reserved, an unreserved compartment where if you go and if there is place in that, fine, you will get in. If there's no place, then you will be disappointed. So basically, what is going to happen is that in a hospital, typically the state agencies will decide as to how much should be for the walk-ins and how much percentage should be displayed for registration. So essentially, depending on the facility, the people will be able to go in and get themselves registered. And
Right.
they don't have to do pre-registration there. They will simply, their identity will be verified and their age will be verified. Whatever document they bring in, like Aadhaar has Aadhaar, passport, driving license, photo ID card for elections. All these documents have your name, your age, and your gender, and your photograph. So they are verified, and then you will be, injection, the vaccination will be done. So where the help desk is there, they are not getting people registered. They are just simply verifying them and allowing them for vaccination.
All right. I asked that question because in several places in Mumbai, for example, some of the hospitals, there were lots of walk-in people. They said we didn't even try. And then the hospital very proactively helped them register in front of them. So they were just doing the technical work for these people, which I think is a great idea. It's something that other hospitals can also actually learn from. So this is great feedback maybe. But, on your question of demand and supply, now, you very correctly put out that phase 2 is going to be extremely critical because, like I said in my introduction, we've gone from vaccine hesitancy to vaccine enthusiasm now. People can't wait to get vaccinated, correct? And so far, you didn't have to perhaps face the challenge of supply because the numbers were known. Are you prepared to have the kind of supply system required, which will only be picking up in the days to come?
Well, I will not be really able to answer that question because my mandate is limited to creating and maintaining the technology infrastructure, which is so much required because unless you have this, then, for example, you have to ensure that a person has got vaccine X in the first dose. The same vaccine must be given to him in the second dose too, because that, you can't change the vaccine. So those kinds of things cannot be done unless you monitor individually. Similarly, if a person has been vaccinated at day T1, then the next vaccination slot will be 28 days after this. And he or she has to be informed through an SMS saying that your next dose is due on this. Please make reservations, or if you have already done scheduling, please ensure that you are present on that schedule. So this tech backbone is my mandate on the issue of supply and logistics of the vaccine. That those numbers I don't have, so I'll not be able to answer that question definitely. But I'm sure Dr. V.K. Paul, who is the chairperson of the NAGVAC, or the health secretary or the honorable health minister, will be able to answer
Right.
that question.
We are actually waiting for that press conference to happen. For some unknown reasons, it got cancelled a little earlier. So people are a little edgy about the details over here. But I know it's not your mandate, but can I also ask you if you're aware of any sort of people who got any serious reactions today, especially the elderly or those with comorbidities today? And is there a particular section on the app, for example? Let's not call it an app actually, let's call it a website for everybody's better understanding, right? So on the website at least, on what can be done in case, what SOS emergency can be done in case there are any reactions that a person has, even if they've gone back home after that, spending that 30 minutes in the hospital?
Now, that's again a very important question. What is being done as a standard operating procedure is that a person is asked to wait for 30 minutes, after the vaccination, and then any adverse impact or adverse effects are watched. And in case they are there, hospitals have been directed to ensure that they should take care of it. So basically, out of a number of conditions, one important condition is that you should have the wherewithal to ensure that you take care of the people who get after adverse impact. Number one. Number two, after 30 minutes, people are allowed to go home. And in case they do develop some complications, they will be able to contact the hospital. We have given the hospital's numbers also, so that they can contact on those numbers. Or in case they have issues there, then they can contact the helpline, which is 1075, and then we can guide them as to what to do.
Right. I have last 1 minute on the show, sir. So I just want to ask you about, in fact, get your response to one of the loopholes that perhaps has been found by the people already. Okay, the government has said so far that they will not be revealing at all on which brand of vaccine are you getting. Are you getting Bharat Biotech or are you getting the Serum Institute vaccine, right? But there are some who are saying that you could easily call up the hospital and ask them and they tell you. So if they have to, they figure it out finally anyways, why not just put it on the app and let it be clear for people to figure it out?
No, I think that's not a good idea, because for us, for the government, because for us, both the vaccines are equally effective, and we feel that there's no difference in these vaccines, and therefore we would not like to choose one over other. And depending on the supply, we are actually, putting these vaccines on the centers.
All right. Thank you so much for your time, sir. Lots of key questions answered there, and good luck to you. The times have just begun. I'm sure it's going to be a challenging task. Thanks for joining us on FYI.
Thank you very much.